Okay, so let's start the panel with questions. Anyone have any questions?
Yeah, I have one.
Oh, yeah. You want to start?
Oh, I just had a comment about the. Is that right? So in Sherree's talk, the slide that had the different theoretical theorists that worked with psychedelics, so there was Jung on the bottom, I think Maslow, Roth. One of the things about all those people they have in mind, and which is really kind of a lack, is that they're all really mental centered and not as somatic, except Groff perhaps. Yeah. And so, so I was thinking about the question about why you would wait, why you prepare a few weeks ahead and wait a few weeks after. And I think in a way it's just to pause, to become mindful of the body, let the mind have time to relate to the body through diet and time afterwards, because I think the psychedelic experiences work on the body-mind as much as on the psychological mind. Even to the extent in psychopharmacology, most in the body, most serotonin is most active outside of the central nervous system. And so the other picture of the nervous system that you put up there, which is really great, we tend to think there's a central and a peripheral nervous system, but I think with psychedelics there's one nervous system, and the serotonin is working throughout the whole nervous system. And even the different organs, like the gut, will speak to you and be spoken to. So I think it's difficult for the mind to listen to what the plant is saying, but also maybe it's also hard for the mind to listen through the gut. And I think a lot of the plant agents speak through the gut, and so we have to get in tune with the kind of language that's shared with our organs. And I think that's probably something that would sound strange if you hadn't already had the experience and go, that makes sense, it's the gut speaking, or it's the different organ systems. And so that's why it's particularly difficult for the different psychological theories, because they're very conscious centered. And so the Jungian one, I think, lends itself better, at least, to taking a step toward that, looking at, in a sense, depth psychology as getting into touch with some resources that are not necessarily through the conscious mind. And the Jungian is, I think, superior in some ways to the Freudian, because Freud, through his own hang-ups, basically really wanted to put a hard floor on the personal unconscious. I think he was spooked by anything that was transpersonal. He was fascinated by it, but he was kind of spooked, and that was really where Jung and Freud fell out with each other, because Jung was open to the more transpersonal, collective, and cultural unconscious. So I think that that is, if you're going to do psychological integration, I think you should have the broadest kind of sense, which is sort of body-mind rather than mind-body dimensional view.
Yeah. And clean your gut before that. And clean your gut before.
Clean your gut.
Yeah.
Well, guts are supposed to be, that's the nature of the gut. I wouldn't say they're dirty, but they're supposed to do what they do. You clean it too much and then you get sick. You don't want to really clean your gut too much. Right?
That's awesome. That was really awesome. Thank you.
So sorry.
I was talking to Jenna about this a couple of minutes ago. I was struck by the case study, and the guy has this peak profound mystical experience followed by a series of catastrophes. Now, I experienced, not to that extent, but I experienced something very similar after having the greatest mystical experience I ever experienced about 6 months ago. And I had just one thing after another that just, it didn't make any sense that all these things would be chained like that. So, and I've asked other people about this, and people seem to believe that there's some possibility that you can blow a hole in the fabric and, and release this chaos, it almost sounds transpersonal because this stuff is happening to other people as well that are connected to you. But do you have any Any ideas about that?
Well, I think you can. I think part of the discussion around some of the contraindications or risks with people who are so-called, diagnosed with bipolar or psychosis. That might be one of the worries that people have about sort of blowing a hole through the fabric. But my sense is that those people are already adapting fairly well with many kind of holes in the fabric. So I think it's harder on the therapist, frankly. I think you mentioned something like that. I think therapists and psychologists and psychiatrists are reluctant to work with people in general who are psychotic or bipolar. I mean, most therapists really kind of hold back from working with that, but also doing anything that would accentuate their states or exaggerate their states. It makes the therapist a whole lot more nervous. So, and when you say blowing a hole through, I think that's the danger that, I don't know exactly what you mean by that, or if you mean the hole in like the collective sense, through your own personal experience. I think that's what you're talking about.
Yeah, I'm saying blowing a hole in the fabric of reality,
in the
or
fabric of
something
reality.
like that.
Yeah. Well, I think that is an experience that people who are working together can feel, both the therapist and the patient, and it's probably even more frightening for the therapist who's so committed to their kind of rational consciousness than the person who may be more used to having that kind of flexibility of mind. So I really think when it comes to the bipolar and schizophrenic people who are using these kind of substances, they're kind of more used to dealing with holes and gaps and fluidity than the actual rational, egocentric psychiatrists and psychologists. So I think it's harder to find therapists who can actually work with them on that. As far as in the whole system, I mean, that's a bigger issue, but I just keep thinking of the web of Indra. You can kind of Google that and get a picture of that. I think if there's holes to be had in the fabric, it's part of the fabric itself. I mean, I wouldn't be overly concerned about that. It is a problem for the ego, though.
I want to just address a couple of things, because I'm hearing, one is, yeah, you can blow a hole in your auric field. I mean, I was completely shattered in terms of my auric field, but even besides that, what I'm hearing you say is when external events start to get really chaotic, and that's a really common phenomenon after like awakening or mystical type experiences. And although I don't have like an explanation for it, I've definitely looked at and spoken to a lot of people about this, and it seems like there's, I mean, as inside, so outside, and I don't know that you could even really say that it's causal, like the internal causes the external or the external causes the internal, but it's like whatever is vibrating for you at that particular time that creates that internal process is also maybe creating that external process. And so that's where people like that may start out in an emergence process can actually go off the rails in an emergency process, because if the outsides are not stable enough to hold the shifting insides, then it can get really fall apart kind of thing.
I think, not that this adds clarity to the whole issue, but I think Jung's fascination with synchronicity is probably relevant to what you guys are talking about. I mean, when clinicians and people who are working with psychedelics, there will be people who did not even identified themselves ahead of time as, say, having a mental illness. It will emerge from the experience, but one experience that it was actually holotropic that I remember with a group of people. There was somebody who was really showing a lot of psychotic behavior ahead of time, and had a break during the holotropic, ran out into the desert. But one thing that I would say, even though whatever his experience was like, he did not get any jumping cactus on him. So something was functioning well, because the rest of us couldn't go outside of the path without getting, we weren't in tune enough to our environment to avoid the jumping cactus. And this guy went barefoot in a moonless night out in the desert and had no jumping choya. So I think it's all anecdotal, but that kind of impressed me.
I have a question about your case study with Stephen. So it seems to me that he had these mystical experiences, so he was able to overcome the depression and the inner critic. Now, could he have had a mystical experience that was not ayahuasca infused and have the same results? And if yes, what kinds? And if not, why not?
Great question. So I just want to make sure I'm hearing it correctly, but you're asking, could he have had this type of mystical experience without the use of ayahuasca?
Well, to get
or
the
with
same results of like getting rid of his depression and, you know.
I mean, I think there's a number of ways that people experience these mystical type of spaces. Some is ingesting something, some is a spontaneous awakening. Holotropic breath work would be one where you're not ingesting something, you're working with the breath, right? So there are other ways. I would imagine, I have no idea, right, what that would look like if it showed up in a different way. But I would imagine any of these places where we come to that space, such as he came to, which we can access in a number of mystical type of, I mean, that is a mystical type of experience, right? That unitive space, that unconditional love. I would imagine in any non-ordinary state, there's a healing effect. Did you feel that I answered that? And I don't know if either of you have something.
I would say yes. I mean, I would say that analysis is a psychedelic. I mean, its intent is to be psychedelic. Often people will say that there's more intensity in the time frame of using plant agents, but I'm not sure if I mean, I used to believe that, but I'm not sure the time metric is the key issue. I think that they're both psychedelic. I think we were talking right before, and a lot of you have probably seen Jung's Red Book. I don't think he took any plant substances. I don't know, but my guess is he didn't. But he was having psychedelic experiences, as you pointed out. And I personally think his body organs were talking to him, and he was making the pictures that are reflections of his being in tune with his body in a different way. Particularly as a European sort of Christian intellectual, that was mystical and psychedelic for him. The revelation of his own embodiedness. And I think he found a good medium for expressing that through paintings. He painted anyway, but those paintings are different, you know, so I think, and that was over, I don't know, 15 years or something. So the time metric, I don't think is this key, because something can start fast, but you know, it could start fast, but take 15 years, or it could, you know, the time metric I don't think is the key issue as much.
I think a lot of it also is, you know, there's a saying, when the student is ready, the teacher arrives. So energetically and spiritually speaking, you know, obviously the interaction that this individual had with Jenna, in this instance, there was some usage of Jenna in the teacher reaching out to this individual, but not to say that if it was not her or not this particular medicine, I'm fairly certain that there would have been some sort of another awakening. For example, like Jenna said, holotropic, there was also the idea of Kundalini awakening, that sometimes just in the middle of their life, even through a yoga session or just sitting in some sort of a temple or a meditation session, you start, what's that?
Giving birth.
You're giving birth. And the energy literally starts moving through the chakras, and then you get an awakening. And oftentimes it does have to do with also, not only, but traumatic experiences oftentimes happen for the purpose of that awakening as well. So clearly there was something in his life, in this individual's life, that deemed him ready to receive this type of healing, and in his particular case it was this medicine. But there are definitely, I mean, even in the medicine world, there are many other medicines that are able to provide a mystical state, but it's absolutely, in my opinion, not limited to. Yeah. But as Dr. Troedson said, also the idea of the intensity and the acceleration, definitely the ability to accelerate healing, I feel has a lot to do with the idea that it is a plant medicine that is very intelligent, for sure. Yeah.
I wish as therapists we could use it more. It's really risky for therapists to work in the ways I think some of us would want to, which would be to actually work with people while they're in a session, a psychedelic session. But it's not, the system we have in this country is not really set up to make it safe for therapists to do. If they want to continue doing work with their license and so on. And so most of us probably will work with people who come back and report their experiences, and that's fine. But I think it would be really interesting to work with people at the time, which is, you know, before you're a therapist and you're not an official of any sort and you're off in your various collectives, you learn how to do that with each other. But then once you get your license, there's more restrictions on your freedom to, which is too bad, because like from my experience, I was much untutored and not completely knowledgeable when it was an informal or not a clinical. Working with people on psychedelics was not a clinical. I wasn't clinically informed, but now that I am clinically informed, it would be better to be able to work with people while they're in the state. Some therapists can in some states, but it's a lot of risk on people's licenses.
Yeah. Well, in a few years also, they are projecting that in about 4 or 5 years, MDMA will be legal for use in a therapeutic setting. So that's a step in the right direction, for sure.
Along those lines of the red book, and you mentioned the visionary part. I'm just curious, as the therapist-patient relationship, the patient having all these visionary things that it's so much and changes so much, and you can't even draw it or describe it, I guess, unless you're an artist or something. How are you as a therapist able to interpret that and put words to it when it's not, you know, it's not a sound, it's not a voice,
Sometimes it doesn't have to be like these super complicated, incredible paintings. Like you need to be a Picasso or Van Gogh to draw, right? But sometimes it's all about drawing a few lines and starting to just move your hand on a piece of paper and symbols start coming out. And really, it's about taking all the little fragments that were in the experience, and the more that you really process, you do a lot of processing around it, for example, through talking, through journaling, through the other practices that we discussed, a lot of information and knowledge does come out and the pieces start coming together, if that makes sense. So it's...
like, there's the DSM for psychology. Is there besides the red book, a manual that says, okay, well, if you see this, then...
No. I mean, that's my answer.
To interpret? Well, I think if you're inclined to interpret's probably the wrong word, but it would be the same thing with dreams. I mean, you're facilitating their expression. You kind of don't want to pin the butterfly on the wall, right? You get more out of it by watching it move. So if an interpretation pins something to the wall, you kill it with the interpretation. So I would say that would be a one-sentence book to say don't kill the symbol.
Well, that's kind of my issue.
The title and the content.
Not being able to express that stuff.
Yeah.
On top of that, someone else trying to listen and trying to interpret it for you. It's like, well, what's
I mean, it's a collaborative process.
Yeah. Well, the other thing to do is that what can be really helpful, I think, is both they were saying this, that to witness it. So it's not so much to interpret or validate it, but witnessing is a kind of validation. Witnessing, supportive acceptance and witnessing of a person's drawing or process. You don't have to, and it wouldn't actually be helpful to sort of validate it based on knowledge or experience or hierarchy or anything like that, but to witness it and accept it would be sufficient for the person to maybe accept its validity for themselves. That would be the second sentence. Just the same thing with dream books and these interpretations. They're not really that useful. Other than they give you a record of how people culturally and historically have tended to think about images. but you start with with the person's own experience, with Stephen's experience. You don't want to go further than that. You want to begin there and let that arise and witness it. I think your case was great with that. Because what could you do to add to Stephen's experience that he didn't get through his own revelation of his own psychic resources through the plant, or maybe through all kinds of other things? The plant is just part of it.
I was wondering if there's like specific integration strategies for certain like very reality-breaking things. For example, say in a ceremony, like you experience telepathy uninterrupted with your friend or something, and then later on, after the experience, you think, like, what if people can hear my thoughts in everyday life?
So you're asking what type of an integration strategy to do with, well, I guess I think I don't understand the question then. I'm sorry. How to translate this particular
Well, it's like he's had a
event?
telepathic situation in ceremony, and then afterwards is the person's almost afraid that other people are reading their thoughts and
or experiences of that nature, of like where your entire paradigm is broken.
I mean, I think that's sort of what we were talking about. That's part of the way I see it, is that's part of that destabilization process that occurs after that type of experience. So I don't know of a specific integration technique other than that would be a space to be really doing integration work, holding that space for that person as they're moving through that, if I understood correctly.
Right, and just by process of the relationship and having someone hold that space for this individual and to reflect that they're, it is a natural process and everything is okay and you will move through it eventually, and that on its own can provide a lot of healing for that.
But I think we kind of grow up, or we're socialized to assume and try to maintain a private world for each of us. So when we have experiences where we see that there's a potential for more permeability between consciousness, it's new for us. And when something's new, it can be frightening. So then the thought could be, somebody could read my minds. Well, of course they do. We've been reading our minds through language the whole night, right? So it's not. So the idea is that if when you're first introduced to the idea that we're not just in our private worlds, but there's a permeability between worlds, then it can be frightening. But then as you get used to that more, you notice that what the possibilities are. It's sort of less frightening.
So it's also in some ways then normalizing that experience.
Yeah, because a lot of times we're just not paying attention to the potential we have a permeability. We've all had experiences where the veil between us is more permeable and inner flowing. And it's just that we don't have those experiences very often. Like, how many times today did each one of us have one of those inner flowing permeability experiences? And how much of the day was invested in a kind of private world? That would be kind of, except for coming together. But we're still kind of sharing a private world in a group of people, but seeing the potential of permeability of inner flow. And I think that's probably one of the things that psychedelics would teach, is that there's a possibility of communication, but it's frightening at first, because it's like when you're in junior high, your biggest nightmare is being naked in public, right? Until you go through your psychedelic thing and you're just like out there, right? Yes. I mean, we all are naked in the room here. We're just covered with things, right? So it's a perspective difference, right?
Just for that particular comment, the last ceremony, that there was apparently like harmaline, this compound that's in ayahuasca brews, when it was first discovered, was called telepathy, because it heightens people's empathy to a level that was so high that it was like you could just read other people's thoughts. So maybe keeping in mind that some of the medicines are really pushing you towards a place like that too, that may not be permanent based on, it's like you're in this heightened state and you experience telepathy, and it's possible, but that doesn't mean that it's happening all the time.
I just thought too that looking at the brain wiring after people have psychedelic experiences, and there was a recent publication around LSD and what happens with that, but it can happen. I mean, I've seen it after DMT, people's brains remain very flexible in that hour afterward. And I imagine something like having the experience of reading people's minds. We all interpret body language when we see people, even if it's unconscious. Imagine if that gets temporarily really wired into the auditory cortex. And so words suddenly come up that make sense for exactly what you're seeing with the person. And there are people actually who have never had psychedelic experiences who grow up that way, and then they have to shut that out because that's, not even if they're told it's weird, it's just overwhelming to them because they have this experience and it's challenging. So just having the brain wired in different ways that are culturally atypical. Yeah.
I mean, just stone sober, how many times have you finished your best friend's sentence, right? Like, it's like, okay, like you're obviously, like going back to what you said about that permeability, it's like, it depends who you're with. You can literally be of the same mind sometimes.
And another thing that you could do is also to work with it, like work around it. Look at this new tool that you have and ask, what is the idea behind this? What are the possibilities with this new talent that I have, with this new option that I have now that I didn't have before? What can I do with this? And in what way? How can this serve me, and how can this actually serve others? What's the potential here?
Okay, after this we got to stop too, so we can have time for the didgeridoo, but you get the last one.
Sure. So I wanted to see in the same vein you were asking about telepathy. So at the center where I was working at, I saw many instances where pasajeros, or people who would come, for treatment, they would be at the center for 10 days, for a month. And these people have never met each other. And they would experience specific details of something that they're working through the collective, the ceremony. And we would find this, because people would share in group sharing circle in the morning. And what I'm trying to say is I remember my teacher saying that we're all spiritually sitting in the Maloka, right? This is where people sit and have their ceremony. And that we're all one, and that we're healing together. And the people that come, during that time, the specific range of time for 10 days, for 3 weeks, we're all doing this together. We're coming, it's for a purpose. We're meeting these people for a purpose. And there is a spiritual purpose. So I just wanted to give a little bit more to what you were discussing and sharing with us.
Thank you. Okay, I'd like to thank the panel, and before we now Ben will close with the didgeridoo, and you're welcome to stick around after that to mingle and ask questions.
That's great.
So for those who haven't heard Ben playing his didgeridoo yet, you're about to get a nice treat, a sound bath. So this is the time where you want to get comfortable, even sit or lay on the carpet if you wish, and just let yourself bathe in the vibration of the didgeridoo. It's very healing, very grounding.
Sure.
Or very activating, it depends on which
Now these things are about telepathy, I swear. So as we close tonight, come back to those intentions that you said at the beginning. Come back to those words. Come back to that breath.
Thank you.